1, 2, 3. Happy birthday. I was 35 weeks pregnant and had my normal checkup, and my platelet level was high, my white blood cell count was high, and I was extremely anemic. Shortly after the boys were born, we sat down with the doctor and he said, okay, these are the 4 things he thinks it could be, but the one that it's most likely is called chronic myeloid leukemia. It's Friday. By Monday, you need to be done breastfeeding. We're going to start you on these meds. So that was the day everything changed when I got that news.
This is Mary Jo, a mother of 2 living with cancer.
When I was talking to my doctor, he explained some of the pros and cons of taking the medication. And it comes with literally a book of potential side effects and warnings and risks. You need to take it 2 times a day, the rest of your life. You're telling me all these potential horrible side effects. What about having more children down the road? And that's where it really kind of sunk in, because my hematologist said, I can never recommend you get pregnant as long as you are on this drug. It would be detrimental to your baby. This is not what we had hoped. This was not what we had dreamed. And we knew that we would take this on and that we would fight through this.
So let's go back in history a little bit and think of this disease. We started out in the 1960s where patients had no treatment, no option. Mid-1990s, patients now need a bone marrow transplant. And then in mid-2000s, we have these amazing drugs that patients take just a pill every day and they're doing really well. Patients are living longer, but now we want them to not only live longer, but to also live better.
Dr. Atala is a leukemia expert, and my expertise is in ways to measure patients' quality of life. We had a good sense previously that stopping these drugs was safe. Patients having had a deep response to the drug can then be taken off the drug and they'll do very well. This is a unique trial in the sense that we aren't adding a new drug to patients to try. We are in fact telling them to stop taking a drug that's working for them.
This drug that saved your life, you no longer are on. So what happens if it does come back? Of course, the thought of going off the med, you can start imagining what your life will be if you had the choice to have another child, if you could get rid of those side effects.
I met with Mary Jo, we talked about the criteria, we talked about what we know, and she signed on.
1 month in was looking good. All of a sudden it was 6 months in and I had none detected that entire time.
Based on our study, we started a CML consortium that will be led by the Medical College of Wisconsin. And our goal is to define and identify how can we get patients off drug and how can we cure everyone.
And my husband and I started talking about, well, if we're gonna take a leap of faith and expand our family, now's the time. And within a month we were expecting. So that was a huge milestone for us in this miracle of this little boy who's due at the end of May.